Well, hi guys, my name is Brandon Ayres from the Cornea Service at Wills Eye Hospital and Ophthalmic Partners of Pennsylvania, and welcome to Best Practices in Keratoconus Management, the podcast, right? On this podcast, we're going to discuss several topics surrounding keratoconus, especially focusing on collagen crosslinking. We're going to reach out across the country and talk to friends and experts and see what's worked and maybe what's not worked for them when it comes to collagen crosslinking. Now, we've talked to several different doctors in different aspects on cross-linking to see what's worked, but today we've got something different. We're going to talk to the administrative support structure, okay, and how that plays into getting our patients treated and treating keratoconus. And I've got two fantastic experts for you today, okay? One is Susan DeGroot from Vance Thompson Vision, and the other is Vivian Cole from Horizon Eye Specialist Laser Vision. And I want to talk to these guys and see what they're doing to help their practices patients with keratoconus. So welcome, Susan and Vivian. Now, look, guys, this is not a contest to see who's coolest out there. We want to talk to each other and get some tips on what you guys are doing to help get patients into the practice, approved for cross-linking, and then treated. So I think we could probably all learn something from each other in this, including myself.
I'm the executive director at Vance Thompson Vision Bozeman. Vance Thompson Vision, as a practice, we have 9 locations in 7 states. And so I run our Bozeman, Montana office, and we are an anterior segment practice. So we only do surgical care and complex medical. And my role is working with all of our team who's responsible for making sure that we get our keratoconus patients treated timely. So I oversee all of the clinic.
Vivian Cole here in Phoenix, Arizona. I'm the director of administrative services, and 2 teams that I oversee are the revenue cycle team, and I also oversee the surgical planning team. We have 8 different locations, 6 surgeons, 10 ODs, cross-linking, cataract surgeries. So I like that I have these 2 roles that allow me to see, when I'm reviewing a patient chart, I can look at it from the clinical perspective, but also I know what the insurance policies consist of as well. Well, one of the processes that I helped streamline was ensuring that from the moment that patient makes the appointment and they're aware that they've been diagnosed with keratoconus and they're being referred to us, which the majority of the time that's the case, we want to get the ball rolling with making sure we get as many medical records previously as possible, especially the last 2 years.
We do that as well. The other thing we've done is structure our schedule so that within 2 to 3 weeks, if not sooner, of the referral, patients can get in. So that, as soon as either they're referring optometrist or the patient themselves are taking the action to schedule the appointment, that we can get them in, as soon as possible to get the treatment schedule started.
How do you keep track of all that? Do you have systems like Susan? Do you have systems that you're using? Is it rubber bands on your finger, or is it spread charts, Excel, or just sticky notes everywhere? Because keeping track of all these patients is very confusing. Like when I walk out of the room, like somebody will come back and say, "Oh, for Mr. or Mrs. Jones, we need to make sure we do whatever," and I've already forgotten who that patient is. I'm already kind of on to the next. So there's got to be some way of making sure that when we're treating these patients or when we're trying to get that, the approval and getting the data, that we've got some kind of a checklist. I wouldn't be very good at that if that was my job. So like, Susan, what do you guys do to try and keep track of these patients to make sure the job gets done?
Yeah, we use our EHR a lot. With patient tasks and putting it out there. So then my team always wants those gone. But we're also working on a dashboard. So once they're actually in our system and we see them for their first evaluation, we'll be able to track and see, when they've had surgery. But a lot of it is in our EHR and just following up on it between our technicians and our counselors and back and forth with those notes to make sure we get them.
A problem that we have run into, and I think it's a common issue, is the first eye from the doctor-patient perspective is pretty easy. You've got a problem, it's getting worse, you want to get this treated, and they do the first eye. And cross-linking isn't the most fun, especially for the patient. We have to make an epithelial defect. It's going to be uncomfortable for a couple of days. And we're usually treating the worst eye first. At least that's how I treat. I can't speak for all the practitioners out there. So really, the second eye in many cases is the most important because it's usually the better eye. Maybe it's the eye that the patient is relying on, and finding ways of making sure that we get that second eye tracked and treated is really important. And is there anything that you guys have found on the administrative side that helps ensure or helps streamline that treatment of the second eye? Susan, Vivian, thank you so much for joining me over the past 20, 30 minutes. I've learned more about your role than I even care to know. I mean, it's so much work. And I really think that we, in our practice anyway, at Ophthalmic Partners, we rely so heavily on our administrators. And I forget sometimes how much I'm asking them to do, but just like you guys, they just keep doing it and keep giving more to the patients. So we really owe it to you guys in getting these patients in and treated as efficiently as we do. So thank you so much for all the hard work that you do so that patients get prompt and proper treatment for keratoconus.